I'm Dr. Daisy Lazarus, Associate Editor of the Heart Rhythm Management online community on CardioSource. It is my absolute pleasure today to talk to Dr. Barry Maron, who is the Director of the Hypertrophic Cardiomyopathy Center of Minneapolis Heart Institution Foundation. We're going to talk about Dr. Maron's recent publication on risk stratification and outcomes in hypertrophic patients over the age of 60. Welcome, Dr. Maron. Can you tell me why you choose to study older patients with hypertrophic cardiomyopathy?
Yeah. Well, patients over the age of 60 is the fastest growing group of patients with this disease. They are being identified with greater frequency fortuitously for a number of reasons. And the question that came up is, are patients in this age group, 60 and 70 years of age, are they at the same risk given the same clinical profile as patients who are 30 or more years younger than they are? That's the question. And what we found was that age counts. Age seems to be, if you like, an anti-risk factor, even with the presence of conventional risk factors. Because achieving a certain age, let's say 60 to 70 years, with this disease seems to convey a partial immunity to sudden events, even given certain risk factors that have been present for years. It's as if the disease declares itself for some reason that we don't know, and that patients pass through risk phases and then are at greatly reduced risk thereafter. The data are that sudden death risk over the age of 60 was about 0.2% per year, probably no different, if not less, than in the general population. So there is a burnout effect, apparently, based only on aging. This has a very important connotation or implication for risk stratification and decision-making for implantable defibrillators. There's less justification, for example, everything else equal, for a primary prevention defibrillator in older patients who are asymptomatic but may have a risk factor. So I think this has changed our clinical practice already, and will continue to, because these patients are appearing for the first time in greater numbers.
So your study has impacted the 2011 guidelines. So what is the take-home message for our clinicians?
Well, the guidelines are time sensitive. They're done with. They've been formulated at a certain time. They do not include a lot of data that is fast-moving in hypertrophic cardiomyopathy. It is a facet of timing the guidelines. I think that the way to look at it relative to the guidelines is that aging, as I've described it, is a anti-risk factor, if you like, something that mitigates risk, everything else considered equal.
Thank you, Dr. Maron, for that fascinating discussion.